What is the excretory system? What are the functions of kidney? It is very interesting to everybody. See, the blood should be purified. The waste products in the blood should be passed out. Then where it should be filtered, we know the filtration. So the blood should be filtered and then the waste product should be thrown out. Throwing out is known as excretory system. So we are having excretory system with what are the different parts of excretory system? Kidney, ureter, bladder, and then the urethra. There are two kidneys. It is bean shaped. It is present in the backside. It is present in the abdomen, in the tummy. ಹೊಟ್ಟೆನಲ್ಲಿ ಹಿಂಭಾಗದಲ್ಲಿ ಇರುತ್ತೆ. Two kidneys I said. Surprisingly, some of my patients, they are having only one kidney, still they are healthy. So the one kidney functioning like as though he is having two kidneys. So the blood will be passed through in the kidney and we are having the glomeruli. I will not go into the detail. So the blood will be filtered and then it passes into the ureter. Ureter means each kidney will be having ureter. Ureter is like a tube and then it will enter the bladder. Bladder will be in the lower part of our abdomen. ಹೊಟ್ಟೆಯ ಕೆಳಭಾಗದಲ್ಲಿ ಇರುತ್ತೆ. When the bladder is full with urine, then we feel the sensation to pass urine and then we go to the toilet and we pass urine. So this is the functions of the kidney. So the kidney, how the kidneys, see, kidney must be healthy, otherwise we cannot survive. The doctors, they say patient is suffering from CKD, chronic kidney disease. The kidney can be, the health of the kidney can be affected by infection, simple infection, and it is known as glomerulonephritis. Once again, I will not go into the detail. So the infection, the doctors will diagnose that the kidneys are infected with the help of the blood examination and urine examination, and they give antibiotics so that the patient will become healthy. Non-communicable diseases, diabetes can affect the kidney. See, in the kidney, the blood, if the blood sugar, blood glucose, if it is more, the glucose will be present in the blood in the kidneys also, and then the ureter, and then the bladder. So the patient will be passing sugar, that is the glucose, in the urine. So the doctors in the laboratory, they examine the urine for presence of glucose. They examine the blood for whether the glucose, how it should be, how much it should be, I said. Fasting blood sugar should not be more than 1 to 6 milligram per 100 ml of blood. The patient will be asked to have food. 1.5 hours after food, the blood sugar should not be more than 180 milligram %. So this is about the diabetes. So the diabetes will be treated by the doctors. The doctors will give proper advice. Then the blood pressure. When the kidneys are damaged, when the kidneys are infected, when the kidneys are not healthy, the patient will develop high blood pressure. As a result of high blood pressure, the kidneys are affected. Kidneys will not be healthy. So the kidneys will be damaged when the blood pressure is more, when the blood sugar is more. Cancer of the kidney, cancer of the bladder, and then even the urethra. Urethra means the place the person will be passing urine. It is known as urethra. So the cancer, diabetes, blood pressure. So any disease, because the kidney is a very important organ, any disease can affect the health of the kidney. And Another thing is, say one day one patient came to my clinic. He was having severe, very severe pain abdomen. I suspected that the patient may be having stone in the kidney, or from the kidney it is passing through the ureter. If the stones are very small, maybe 3 millimeter, 5 millimeter like that, then the patient will pass it out. If it is more than, say for example, 1 centimeter like that, in the kidney, if the stones are present in the kidney, the patient will have vague pain in the abdomen. When the stones are passing out in the ureter, the patient will have severe pain. If it is small, the patient will pass it out. If it is bigger, for example, 1 centimeter stone, then the doctor will refer the patient to the specialist in the excretory system, kidney specialist. It is known, they are known as urologist. The physicians are there to treat by medicine. Surgeons are known as urologist. The physicians who treat kidney problem, they are known as nephrologist. So the nephrologist, or if the operation is necessary, urologist, they treat the patients. Now the patient has gone to irreparable damage, chronic kidney disease. Then the patients will be referred to the hospital. They do the dialysis. They advise dialysis. What is dialysis? Artificially, outside the body, the system will be there. The different operators, the instruments, they will be functioning as though it is functioning like a kidney, but it is outside, and it is known as dialysis. If the dialysis is also not successful, then the doctors will advise kidney transplantation. See, the patient will receive kidney from the donor, and the donor and then the patient, the kidney should be, blood should be matched, the tissue matching. See, it is a very detailed process. And the patient, there is nothing like 2 kidneys donated by one person. He should also survive. The donor also should survive. So the donor will, for example, the wife will, this blood group is same, tissue matching, everything is done. The wife will donate 1 kidney to the husband, or the husband will donate 1 kidney to the wife, or a brother will donate. A son will donate 1 kidney to the father, like that. So they can survive for a long time. But the matching is very, very important. Sometimes the kidney donor, some other person, a poor person, has donated a kidney. Sometimes it may not be matched properly and it will repel. So failure of kidney transplantation. So this is in very, very brief about the kidney. So the kidney, ureter, bladder, urethra should be healthy. They form the part of excretory system. So this is in brief. And we advise the patient to drink plenty of water, so that the patient will pass urine frequently, and the waste products should be excreted. Otherwise, those who do not drink sufficient water, minimum 2 liters of water in a day, then they are more prone to develop stones. Thank you very much. Please disseminate this information to others in the community. Sarve jana sukhino bhavatu. Sarve jana swasthi bhavatu. Namaste.